Hi guys, welcome back to 4 Strong and Growing. My name is Alexa and I am a mom of 2 and I'm also 24 weeks pregnant with baby number 3. In this video, I want to talk all about the anatomy scan, considering I just had mine a couple weeks ago. So while it's fresh in my head, I not only want to go over my specific results, but I want to answer some common FAQs like, what is the anatomy scan? When is it performed? How do you prepare for it? Who performs the ultrasound? What they look for? What you'll learn? And what happens if they find something wrong on the scan? So let's get into it. So what is the anatomy scan? The anatomy scan, which is also called the 20-week scan or the anomaly scan, is an ultrasound that checks physical fetal development and detects indicators or markers for certain congenital defects, which are defects that your baby could be born with. When is the anatomy scan performed? Usually the scan is performed between 18 and 22 weeks gestation. I would say most common it's done at 20 weeks. This time around, I was supposed to have it done at 21 weeks, but I was away on vacation, so I had it done at 22 weeks. So how do you prepare for the anatomy scan? Well, it's usually a longer appointment than usual, especially if you're seeing your OBGYN afterwards. The scan usually takes around 45 minutes, and then if you're seeing your doctor afterwards, I would plan probably upwards of 75 minutes for the entire appointment. So just plan accordingly for that. Come with a full bladder because that helps with the visibility of the fetus during the ultrasound. And if you don't want to know the sex of the baby, tell that to the sonographer before they start the scan. Otherwise, you might get a sneak peek or they might say it by accident. So just let them know beforehand. So who performs the ultrasound if it's not your doctor? Usually it's an ultrasound technician or a sonographer. While they can answer certain questions like what body part you're looking at on the screen, they cannot interpret the results of the scan, which is like kind of a gray area. Certain people will probably tell you more information than other people, but generally speaking, they are not supposed to diagnose you with anything. So if they see something wrong on the scan, they'll have to go get a doctor to come into the room and explain what they see to you. What does the sonographer look for during the anatomy scan? Well, it's a long laundry list of things. I was given a list of all of the anatomical features that the sonographer would be looking at during my anatomy scan. I'm not going to be able to say it from memory, so I'm going to read it off of my phone, exactly what they sent me. Okay, the face, the brain, specifically ventricles, choroid plexus, midbrain, posterior fossa, cerebellum, cisterns magna, measurements of anterior and posterior horns of lateral ventricles. Then in the skull, the shape, integrity, BPD and HC measurements. In the neck, nuchal fold thickness, the spine, the heart, the rate, the rhythm, and the 4-chamber views and outflow tract. Thorax, shape, lungs, diaphragm, abdomen, stomach, kidneys, liver, bladder, wall, umbilicus, cord, abdominal circumference AC, limbs, femur, tibia, fibula, humerus, radius, ulna, hands, feet, femur length, FL, genitals, this is where you find out the gender or any abnormality with the genitals, your cervix, length and opening, placenta location, making sure that it's not covering the cervix like in placenta previa, measure the amount of amniotic fluid, and also the presence of certain congenital conditions such as anencephaly, indicators of Down syndrome or trisomy 18 and trisomy 13, cleft lip, spina bifida, congenital heart abnormalities, missing one or both kidneys, I don't know actually how to pronounce this, gastroschisis, issues with the intestines, I don't know how to say this one either, omphalocele, a type of abdominal wall issue, skeletal dysplasia, which is problems with the bones, and diaphragmatic hernia, which is a hole in the diaphragm. That's a huge list of things that they're looking for during the scan. So now you see why it takes closer to an hour for this scan to be done, because they're looking at so many different things. These sonographers are so skilled. I can never see what they're looking at. I have a really hard time reading ultrasounds. And even though they can detect indicators for certain congenital defects during the anatomy scan, they cannot find every congenital defect on the anatomy scan. So they are specifically looking for those certain ones that they're able to see at 20 weeks and through an ultrasound. It's important to keep in mind that some congenital defects will not be noticeable until the baby is born. So what will you learn at your anatomy scan? Probably the most fun thing that you'll learn at the anatomy scan is the sex of your baby. Even if you did genetic testing to find out the sex of your baby earlier in your pregnancy, this is just a confirmation that yes, they are indeed that sex. You might also learn of any complications with you or your baby or both. And you will probably be told if your baby is measuring on track, behind, or ahead of your due date. And that basically just means that the sonographer is using the measurements of certain organs and parts of the body, and that determines whether they're measuring ahead if they're bigger or behind if they're smaller. And your due date can change if your baby is measuring more than 10 to 14 days either behind your original due date or ahead of your original due date. So what happens if they find something wrong on the scan? I think everyone feels a little bit nervous going into this appointment because there is the opportunity to find something wrong with your baby. And usually if you're going to find something wrong, this is the appointment where it's going to happen. Like I said previously, in the case that the sonographer does find something unusual on the ultrasound, they will probably not be the ones to tell you. They will likely go and get a doctor to come into the room, take a second look, and then explain what they see. So depending on what they find, your doctor may recommend further testing, for example, an amniocentesis. Or they might recommend treatment, for example, if they found a cleft lip, talking about having surgery to fix a cleft lip after birth. In very rare cases where you're given a prognosis that your baby is likely to die either in the womb or shortly after birth, palliative care and perinatal hospice are available. So what is palliative care and perinatal hospice? Unfortunately, I think this is something that a lot of people just don't know about. I wasn't aware of perinatal hospice until I had 2 babies already. I think it's something that everyone should be aware of because it's such a great service for the people who need it. If you've heard of hospice, regular hospice, it's usually a facility that you go to with a specialized team of people to take care of you at the end of life. Perinatal hospice is very similar. Perinatal hospice is not actually a location that you go to, but it's a specialized team of doctors, NICU nurses, midwives, neonatologists, social workers, genetic counselors, all sorts of people who come together and support parents who choose to continue their pregnancies despite these difficult prognoses. They help with things like birth planning, emotional support for the family, medical decision making before and after birth, and help if the baby ends up living longer than expected. Okay, so now let's get on to my personal results of my anatomy scan. Like I said, I just had my anatomy scan 2 weeks ago when I was 22 weeks pregnant. So the first thing that my sonographer told me is that I have an interior placenta. Basically, that means that my placenta is riding on the front of my uterus. I can't remember if I've had an interior placenta before in my 2 previous pregnancies. So that just means that it was a little bit harder for her to view the baby during the ultrasound. She said she wished that she just had a button where she could flip up the placenta and see behind it. So yes, I made things a little bit more difficult in that way. Not that I have any control over it, but my anatomy scan also confirmed that I am indeed expecting a little girl, which I already pretty much knew, about 99% knew from the genetic testing that I had done earlier in my pregnancy. I think that was around 10 or 12 weeks. Geez, I already can't remember. I don't know how I'm already forgetting that, but I'm pretty sure it was between that 10 and 12 week mark. But now I just had visual confirmation that yes, she is indeed a girl. Her heart rate was 143 beats per minute, which is within normal range. She was measuring at 21 weeks and 4 days, so just a little bit behind. That put her in the 26th percentile, which I would say is normal for my kids because I'm pretty small and both my babies have also been pretty small. So I'm not surprised that this baby is also just a little bit small. And the last thing that I learned during this appointment was that my baby is breech, which means that her head is up top and her feet are down low, which is totally fine for this stage of development. Later on, hopefully she will flip around like most babies do so that I can have a regular vaginal delivery. That's what I'm hoping for, and she can come out head first like she is supposed to. Now you're up to date. That's everything that I learned in my anatomy scan. Please give this video a thumbs up and send it to someone who would also enjoy this video. I hope this video helped you learn a little bit more about the anatomy scan. If you have any questions, please leave them down in the comments, and I will see you in the next one. Bye.